pandemic is the kind of story you hope you never have to cover. It's the story you hope never comes to pass in the first place. But it has. And in early 2020, as journalists and arguably the government were reeling from what many labelled as the Brexit crisis, a new crisis was emerging that put the squabbles between Westminster and Brussels into perspective. In the first week of March, the first teams at the Telegraph trialled working from home to see whether it was feasible to put out a daily paper, update the website and make videos and, of course, podcasts from our kitchen tables. By halfway through the month, the newsroom was all but empty. Covering the coronavirus outbreak has come with its own set of challenges, reams of complicated data, science that isn't yet peer-reviewed, the proliferation of misinformation, and then there's the responsibility of shedding light on the stories of those in much less fortunate situations than your own, stories that can be harrowing. I'm Theodora Louloudis, the Telegraph's podcast editor, and I'm delighted to be shedding some light on our coverage of the pandemic for this special episode of Coronavirus the Latest. Joining me are two colleagues at the forefront of it all, Anne Gulland, the deputy editor of the unparalleled Global Health Security team, and Dominic Gilbert, one of our stellar data journalists. And Dom, thank you so much for joining me. I know you are incredibly busy.
No, it's a pleasure. Thanks for having us.
Thanks for the invite.
Since I've already made you battle with the tech, listeners, we may or may not have been here half an hour already. Let me start by asking you about the challenges from working from home. I guess in journalism, lots of our time's usually spent interviewing people in the office. I go to quite a lot of events and conferences. So first of all, tell us where you are and do you miss the office? Dom?
Yeah, it's been a difficult one because we moved house about the time that lockdown happened. It was the same week that lockdown was announced. So I'm now in Brixton, but it's been quite a surreal start to my time here because nothing's open, obviously. So we haven't really had a chance to explore the place, but it's been fine. We got through safely, and I think working from home really it wasn't that much of a pivot for us, just because a lot of data journalism is done online, and frankly, making the most of Zoom has sort of enabled us to tap into press conferences far easier than we would have done otherwise, having to go to locations. So it's streamlined a lot of processes, but I'm not going to say it's been the easiest process.
And do you share my concern that working from home means zero work-life balance?
Yes, no, definitely. I think it is hard to switch off, and the day can sort of stretch from sort of 7 a.m. to kind of 10 p.m. I mean, I'm not saying that that's my day every day, but you are kind of on all the time. There's no excuses, is there, for saying, oh, I can't, I've got to go, I've got a theatre trip planned, or I've booked cinema tickets or something like that. So, everyone's around. I mean, I used to be, before working at the Telegraph, I was freelance for about a long time. So I'm quite used to working from home. But I think for us, I mean, I've got teenagers, and my son should have been doing his GCSEs now. So, I suppose, I mean, I don't have small kids, which I think must be a nightmare, but, there's all that kind of challenges. And, if my husband's on the phone, he can be quite loud. It's that kind of thing. I tell you what, I wonder what's going to be, the office is going to be like there when we get back. I just wonder what the mice are what they'll have done. I just imagine we'll get back and they'll just be like a gazillion mice running the show.
If you follow any Telegraph journalists on Twitter, it's no secret that our office has a little bit of a mice problem, which allegedly, for all the lawyers listening there, comes from a certain fast food chain in Victoria Station that I won't mention for legal reasons. But I agree. I do worry that they might have rather made home in our desk drawers. Both of you, what's it like pivoting your entire job to one story? I mean, politics has dominated so much of the Telegraph's coverage in recent years. I've already mentioned the B word, Brexit. Dom, I know you moved to the Telegraph ahead of last year's election, so you do have some experience on the political beat, but this coronavirus certainly wasn't a story you could prepare for. Tell us a bit what it's like focusing so much on the pandemic.
Yeah, I don't think anyone was really prepared for the amount of work we'd have to throw at this one story. Obviously, everything about it is unprecedented. And all it's meant for us really is that any longer term projects we had in the pipeline have just been thrown into long grass, because we've had to throw the kitchen sink at this for the last 2 months. And with the sheer volume of data that's coming out every day, it's really a struggle to keep up with it. So even if we had double the resources, double the time at work, which we do working from home because we can never leave our jobs behind, as Anne said. Yeah, it's just been the sole focus, and honestly, it's it's nice when you get that weekend just to be able to step away from the news cycle, because it's more intense than it has been for a very long time, I think.
Have you literally not done a chart that isn't related to the coronavirus in some way in the last 4 months?
I think the last chart I did that wasn't related to the coronavirus was the Australian bushfires.
Oh, right.
Which was
when
a long
was that,
time ago now.
January?
Gosh.
That's
Yeah.
It's a lifetime ago.
Feels like it now, doesn't it?
Yeah. I mean, I can't remember the last story. I mean, I write about global health. So we've been writing about this on our little patch since January. And I remember my colleague Sarah Newey saying, "Oh, have you seen this thing about this pneumonia in Wuhan in China? Do you think we should do something?" And I think myself and my boss Paul Newkey both went, "Yeah, I suppose it's probably worth doing a little thing about it." So it's been odd. So this is kind of my beat. So it's not such a massive kind of change for me and the team. But I suppose we're not doing all the other stuff that we would ordinarily do. So we cover I don't know, HIV and TB and things like women's rights and things like that. So I feel they're getting neglected a bit.
Totally. I mean, Anne, you were at the Telegraph for 2 years before?
2 years.
Before you started covering this pandemic. I mean, it has been a complete pivot. We used to have Gordon Rayner, our political editor, kind of forefront of the news conferences in the morning. And he's still very much there. Obviously, the political team are mainly leading the questions at the press conferences. But Paul Newkey, our global health security editor, is right up there beside him. Actually, let's talk about that and the tension between politics and health. And there's been lots of criticism that health journalists should be more at the forefront of conversations with the government and with bodies like Public Health England. Where do you stand on that criticism? Would you like to be there on those Zoom calls putting your questions to the government?
Yeah, I mean, there have been health journalists and science journalists on those calls. I think it would make sense if there were other questions and other another focus. I don't want to criticise my political reporter colleagues, but I don't know. They're a bit odd, those press conferences, because there was the culture secretary the other day, and I'm not kind of desperately keen to go, because it's just a bit of theatre in a way. I think it's just they've kind of committed to these daily press conferences, so now they have to do them. But it's kind of fun, isn't it, to do it and to kind of ask Boris Johnson when he does them, which hasn't been very often.
Dom, when you watch those government press conferences, do you feel frustrated at some of the graphs that they use? I mean, they tend to be either overly simplistic, which maybe they have to be to be projected on that big screen to the nation, or sometimes we get certain information some days that we don't the other days, and perhaps it's more relevant on other days. Tell me a bit about what you feel when you're watching all those graphs on screen.
Yeah, I mean, I think it was the chart with the comparing the number of deaths across countries, wasn't it? Which they stopped using after about 2 months of presenting it to the nation every single day. And yeah, it's a source of huge frustration every single time, because there is definitely an element of cherry picking data to fit the narrative for that day. And because the goalposts have changed so often with a lot of those metrics, for example, the testing data, at the moment, we're now looking at huge disparities between the number of tests going out and the number of people being tested, which isn't shown in the most transparent way when they present at those press conferences. But luckily, there are so many data sources out there that we can fall back on, that we don't have to rely on those kind of sources of data. It would just be nice if there was a little bit more honesty and transparency in the way they presented it every day, because I think that caused a lot of confusion among a lot of people when certain data is presented from news outlets and it seems to contradict government data because it's possibly not presented in the best way.
I think this story is kind of interesting in terms of data, because everyone now, there's talk about epidemic curves and epidemiology, and it's like everyone's a data expert these days. I don't know, it just feels, I'd say that was something new. Would you say that, Dom? I don't know. Is that something that, people are talking about statistics when maybe they've never, it's more of a kind of general conversation than it ever has been?
Absolutely. I mean, data journalism used to be quite a niche subject, and a lot of organisations have only recently started to hire data journalists. And it's very encouraging, the amount of data that's around and the interest that people have in understanding data and kind of wrapping their head around why it's so important and why it's presented in the way it is, why we have to take into account the prevalence of missing data and all the caveats in reporting it. There's definitely a lot more interest now, which I think that can only be a good thing to come out of this whole situation, that there'll be a lot more kind of literacy among the public about the importance of data journalism, just data in our daily lives, I think, yeah.
Dom, where do you stand on the old adage, the stats don't lie?
That's a difficult one, a really difficult one, because the stats don't lie, but particularly during this pandemic, the problem has been trying to get timely data, trying to get data that we can compare across countries, which, I mean, the response hasn't been great from a lot of countries, which has made it very difficult to report on when there's that clamour to know who has the highest death toll, who has the most cases, where is the pandemic spreading the most. And that's a question we can't accurately answer at the moment with the data we have. But what we can do is we can present the best data we have, find out which is reliable, and present that in a way that tells the story as best we can. We'll never have the full picture until probably, as the government says, later in the year or next year, once we kind of get uniform data across countries and we can start looking backwards with hindsight.
Anne?
I mean, that's the trouble with things like the death data, isn't it? Because, I mean, it's the way people count. You know, how do they count deaths? Is it someone who would have died anyway, but they happen to have COVID-19? It's, you know, and also who counts what cases? I mean, Germany seemed to, because they did massive amount of testing, they had quite a high number of cases, but very low death rate, very low number of deaths. So I think it has presented, you know, that you can't just look, that, you know, these figures have to be really interrogated well. And that's where, you know, people like Dom come in, isn't it? That's why we need people like you, because otherwise it's really hard to kind of get our heads around the figures.
Yeah, and that's why it's so important to start challenging things like testing, because we can only really know the situation in the country if they were testing 100% of people, which clearly can't happen. But that's why countries like Germany are being held up as one of the best case scenarios, because they've done so much testing that we can really start to understand what's happening in that country. Whereas in the UK, if you're not testing people, then we can't figure out the number of people who have recovered from coronavirus, because we don't know how many people had it in the first place. And our death rate will look much higher than it is because we don't know how many cases are out there. So we're almost comparing apples and oranges in that respect.
That issue of recovery comes up all the time. I'm sure you get it from your readers. I certainly get it from the listeners. The question of why we don't report on how many people have recovered in the UK. I mean, when we decided to do this podcast, we put a call out for readers' questions. And Stephen asked, why is everything reported from a negative perspective? Why can't you publish more positive news to try and raise morale? I'd imagine he is referring to recoveries there. First of all, why don't we publish recoveries? I know the answer, but tell the listeners. And is it our job to raise morale?
I think in terms of putting a positive spin on the news, it's been very difficult, certainly from a data perspective, to find positive lines out of the data that we have, because the death toll is just so high in the UK.
And also the recoveries are later, aren't they? So,
well, the recoveries are later, but also we can only report on the recoveries of people discharged from hospital, which obviously doesn't tell the whole story. There will be people who don't know they've had it and have recovered. There'll be people who have recovered at home.
I mean, I think on the point about positive news, I mean, we are trying to do positive news at the Telegraph, aren't we? We have there is a little panel in the paper every day on sort of positive news, and we've got the You Are Not Alone stuff that we're doing. So, you know, I think we are trying to be positive, but I don't think it's really our job as journalists to, you know, we have to hold people to account. So I just don't. I think if the paper was full of positive news all the time, then it would be a bit dull. I don't think anyone would really buy it.
Yeah, I think we've not really been at a stage where we can report positive news until we've really got the virus under control. We're starting to get to that point now. So certainly in some of the data stories, we'll start to see more positive news. We had a story out this week looking at how we are starting to get the virus under control. But up until this point, it's not really been possible because things were spreading at an exponential rate, and it was really difficult to say that things were going well at that point. But we'll start to see that change.
Just for our reader, Stephen, I am going to put a link to Tom Gibbs and Harriet Barber. Our colleagues do produce a roundup of good news stories every day, so I'll put a link to that in the show notes for your weekend reading. A survey by YouGov for the University of Oxford Reuters Institute found that a quarter of respondents felt that the media had exaggerated the crisis. Dom, before you get in there, I know you're going to tell me that means that 75% feel we haven't exaggerated it. Have we exaggerated the crisis? I mean, we are going after headlines.
I think that perception might come from sort of an element of 24-hour news, and the fact that this is all we're reporting on. This is taken over our entire lives. So people will be overwhelmed by the amount of information, the amount of reports on it, and the amount of conflicting reports, which is an issue because that does lessen trust in what the media are reporting. But yeah, I'm sure people are just very overwhelmed, and it's a lot to take in. I don't think that necessarily means we're exaggerating, because if anything, we're understating what's happening because we don't know the full picture.
Anne?
I mean, I suppose it depends whether you feel that the media reporting has led to this lockdown. So, I mean, I don't think we can really underestimate how the impact this has had on absolutely everyone in the country. I mean, there's no one, in the whole of Europe, in the whole of Asia and the States, and, this has had a huge impact. So unless you want to say it's media exaggeration that has led to, governments feeling they have to introduce these lockdowns, maybe there is an argument for that. I don't know. I don't think so. But, this has had a massive impact. So I really don't see how we could have not reported on it in the way that we do.
I think it brings up the fact as well that with a story like coronavirus, more than most other stories, I'd say, comes great responsibility. I mean, publishing the wrong information doesn't only mean a kind of rap on your knuckles from your editor. It's much more dangerous than in other circumstances. And, we've already spoken about, at the moment, everyone kind of seems to have become an expert on the subject. If you publish something that's inaccurate, it'll be picked up. It does risk damaging public trust in the media. I mean, let's talk a bit about the responsibility that comes with reporting on coronavirus. I mean, Anne, how aware are you of the fact that your reporting could potentially have an effect on people's health? I mean, if you reported every claim of a miracle cure that ended up coming to nothing, you could have encouraged a change in people's behaviour.
Well, yeah, but, I don't have the same reach that Donald Trump has, fortunately. I don't think I'm going to do that. Yeah, I mean, no, you're absolutely right. I mean, you do have to be really careful, because another thing about this pandemic, which, I've reported on sort of science for many years. And there's a thing about, when you publish a scientific paper, it goes to the journal will review it internally, then they'll send it to a peer. It goes through this process of peer review. People outside the journal will see it. And then, it could take up to sort of 2 years for your paper to get published, which, is ridiculous. But nowadays, all these papers are going on these, what they call preprint servers. So they're kind of getting published. So, people like me can just go along and get this paper. And we don't really know whether it's accurate science or not. You just have to kind of think, because some of the papers aren't being published by the kind of traditional journals like the BMJ or the Lancet or the New England Journal of Medicine, which are very kind of highly thought of. So it is quite hard actually to sort of understand, sort what is a good study and what isn't. And you sort of have to go, see what scientists that you trust are saying on Twitter or on, there's this organisation called the Science Media Centre, which gather sort of reactions from scientists in the UK. They're amazing, actually. And so I think it is really hard. And I did report on because there was a paper in France which first reported on the hydroxychloroquine, the malaria treatment that Donald Trump has really trumpeted, as it were. And that, I did report on that, but you have to just be really careful. So I remember it was only 36 patients. I think it was only 36. So you just have to be very careful. People get very excited, and maybe non-specialists. So my boss is very sort of clear that he wants us to be authoritative and wants us to not print any kind of nonsense. So you just have to be very clear and just explain that, this is a very small study, if that's the case, and it's very early days. Everything is, I think that you just have to caveat it all the time with, we just still don't know a lot. There's a lot we don't know about this virus. So yeah, so it is a responsibility. I hope that I'm quite responsible. I think I am. quite responsible in the way I write.
We think you are too, and we only have responsible people on this podcast, of course.
Thank you. Good.
Dom, I mean, caveats are something that you're used to, asterisks too, I'm sure. Your work's a bit different because lots of the data that you deal with presumably is verified because it comes from the Office for National Statistics. Tell us a bit about that, and do you still have to have as discerning an eye as someone like Anne?
No, yeah, I absolutely do. I think particularly in data, the Office for National Statistics have wonderful data, and I think we're really lucky in the UK to have them because it's such a reliable source. But then when it comes to trying to find out what's happening in other countries, then it becomes more difficult because we have multiple sources like Johns Hopkins University and many others trying to collate all the data from all these different countries. But what we certainly found at the start of the pandemic was that potentially those aggregating websites were missing small caveats and small nuances here and there. So it certainly became a case of going back to different countries' health ministries, trying to verify certain numbers so that we had the full picture. And then it became a case of, if we saw discrepancies like that, we'd have to decide whether to drop that country from our analysis or whether to try and find a way to present that data in a different way with all the caveats. And it's almost every story we do at the moment is, this is the data, this is why it's certain elements of it might be unreliable, and here's 5 caveats, but this is the best we have to work with at the moment. But certainly in terms of the UK data, there's quite a lag. So at the moment, we only really have reliable data to about the 8th of May because the Office for National Statistics need that time just to collate everything. But that does give us a real benefit of hindsight to find out exactly what's been going on in this country, at least.
But how do you cope with that, Dom, when you've got data from, say, I don't know, the French Ministry of Health, and you don't speak French? Maybe you do, I don't know, but somewhere in Portugal.
Google Translate's a wonderful tool.
I suppose. But I did something about it was to do with testing. It was something that I had to do really quickly, and it was in the early days. So it was to find out the number of tests across various countries, and it just took me forever. I felt like, I don't know, it must be quite hard work for you to find maybe you just know where you're looking now, but it must be really difficult sometimes.
A lot of it comes down to knowing where to look. I mean, I think now things are improving because certainly at the start, it was a case of going through manually, taking hours to collate a spreadsheet. But now what's happened is you have people are taking such an interest in this that you now have kind of cells of people in different countries who are taking it upon themselves to validate this data.
Oh, it's like citizen data journalism.
Yeah, absolutely. Or just people working for independent statistic bodies. So if you know where to look in certain GitHub pages, that has become a huge help. And I think everyone around the globe has kind of pivoted to make this their priority. So, certain people who are furloughed are now just volunteering, taking it upon themselves to try and validate data so that we have the best picture that we possibly can at the moment. So that's been really useful.
Well, we've kind of alluded to it as well, but we haven't kind of explicitly said the speed at which we're all working. I mean, and presumably a lot of your work before, you would get the scientific reports embargoed, so you'd get them the day before you'd publish, and now you presumably don't get that.
Yeah, no, that's not happening at the moment. So it is sometimes quite stressful.
And you know that you're going to get an ONS stats drop at 9 o'clock in the morning, but you get it and you're presumably trying to beat the other papers in publishing it online, but with that level of accuracy.
Absolutely. And just trying to pick out what's going to be most important to people at that moment in time. It does become quite a hectic rush, certainly on Tuesday mornings when the ONS stats come out, just to try and get a good handle on exactly what the situation was in the week they were reporting on. And I mean, frankly, they've started looking into care homes, they've started looking into demographic breakdowns. So whether men or women are more affected, what age ranges are more affected, what underlying conditions are the main risk factors. So these are all things that we've kind of been able to take into our reporting.
Do you both feel like you have enough information, or is that a silly question? Maybe you have far too much. But I asked because a reader called Nigel asked, Probably one for Anne. Why haven't there been any reported interviews with those that lead the NHS procurement or Public Health England? Nigel says there are lots of press releases, but no actual penetrating questioning of those at the top. That's one I get asked all the time as well. I mean, I have people asking me to ask Public Health England about certain decisions that they've made. And much as I would love to do that, it's not always that easy. I mean, do you feel like we're being given enough access?
People like the people at the top of Public Health England, I think they have appeared in the daily government press briefings, and there's someone called John Newton whose title escapes me, but he's pretty senior. I think he might be head of testing or something at Public Health England. He was on the Today programme this morning, I heard him. So I don't think it's that the head of NHS procurement, I mean, that is really interesting. But these are, someone like him they're civil servants, so they're not sort of generally the ones that would be, that you can get, because it's the ministers that do the, that answer those kind of questions. I mean, it would be great to be able to speak to the head of NHS procurement about PPE and why we're so reliant on supplies from China and things like that. But, I suppose they've got a job to do as well, they're probably really busy. But I think it's a valid point. I think we have very good access to scientists and academics, but they're more independent, aren't they, than the people working from the government. I mean, I think in terms of access to information, we've had access to loads of information, but whether it's the right information or not, we don't know really yet, I suppose. I
think that's really the key point. That's really the key point, is that we have more information now than we ever have. It's a barrage of information, but it's missing huge gaps in our understanding. So, I mean, for example, the pandemic's taken over so many departments that we expect certain data releases, for example, the critical care bed capacity and cancelled operations from the NHS, which now just isn't being collated because all these teams are now so busy with all the other data that's coming through. So I think we're missing out on a lot of quite vital information at the moment.
When that data comes out, though, that'll be fascinating, won't it, to see how many cancelled operations, and that'll be really interesting.
They're not even collating the data, so we won't.
Oh, they're not even collating it. Oh my gosh! So It's not that they've not published it.
So that's just not coming, Dom.
Just not coming out.
Wow.
So yeah, there's a lot of elements of society, and a lot of stories we'd expect to hear about will probably be going unnoticed at the moment.
On that note, Dom, I'm going to leave you with a task rather than a question, because it's not one I think you can answer off the bat. But Stephen asked, is anyone anywhere working on how to make valid comparisons of strategy across nations, taking into account all significant factors, including preparation and readiness, population size, population density, age, existing conditions? Is that on your radar?
Sure, they are.
That's a huge task. There's
probably lots of people doing aspects of it, aren't there?
There are, certainly. I think the closest thing I've seen is from the Blavatnik School from Oxford Uni, they have this wonderful stringency index looking at all these different policy responses from governments around the world. So from fiscal support measures to contact tracing to effectiveness of lockdown, things like that. That's probably the closest thing I've seen to that. And I think, again, that's going to be something that comes with hindsight, honestly. Once people kind of come out at the end of this pandemic and have a chance to breathe and can look back and say, okay, well, this is where things went potentially wrong for some people.
Dom Gilbert, data journalist, Anne Gulland, deputy editor of our Global Health Security team. Thank you so much for joining me. And if listeners want to follow you on Twitter, where can they find you?
I'm at Anne Gulland. So that's Anne with an E and then Gulland.
And I'm at Dominic Gilbert.
And I'll link to both our wonderful journalist work in the show notes to this episode. Thank you for joining me.
Thank you.
Pleasure. Thanks for having us.
Nice to chat.
This is Coronavirus, the latest from the Telegraph. I'm Theodora Louloudis, and I'll be back on Tuesday evening with your regular coronavirus news update. If you have a question you'd like me to answer on an upcoming show, record it on a voice memo on your mobile phone and email it to me. The address is coronaviruspodcast@telegraph.co.uk. And a final word from me, if you've enjoyed today's show and you believe in the importance of the press, particularly at a time like this, please consider supporting what we're doing by taking out a Telegraph subscription. Listeners can get the first 30 days free at telegraph.co.uk/audio, and after that it's just £3 a week. And if you want to make me really happy, you'll leave the podcast a 5-star rating and maybe even a review on Apple Podcasts too. It really helps other people find the show.